Hello, and thank you for joining us for Coping with Fatigue. This is the fourth in the Lung Cancer Alliance Coping webinar series designed to educate and provide practical ways to manage the most common symptoms and side effects experienced by lung cancer patients and survivors. I'm Maureen Brigney. I'm a social worker and director of support initiatives at Lung Cancer Alliance. A national nonprofit organization based in Washington, D.C., LCA listens to and serves those living with and at risk for lung cancer to reduce stigma, improve quality of life, and increase survival. We have a whole host of programs and services designed to improve care and quality of life for the lung cancer community. For more information, please visit our newly updated website. Before we begin, we want to recognize our supporters, Helson and Tesaro. Without them, the Coping series would not be possible. So thank you. Fatigue is among the most common, one of the most problematic issues facing those living with lung cancer. Not only those who are in or just out of treatment, but longtime survivors as well. The goal of this webinar is to help you understand lung cancer-related fatigue and to learn some management strategies. To help you remember the information presented today, we'll make available a tip sheet and summary blog. And please know that Lung Cancer Alliance is here to help. We can answer your questions about lung cancer, help you find your best care, understand your treatment options, find support, and so much more. Don't hesitate to contact us at our toll-free helpline, which is 1-800-298-2436, or to email us at support@lungcanceralliance.org. It's now my honor to introduce you to our three expert presenters who will help us understand and learn to manage fatigue from lung cancer and its treatment. Dr. Boris Kravitsky received his doctorate in osteopathic medicine from Nova Southeastern University in Florida and did his residency at the University of Connecticut. Dr. Kravitsky is a board-certified palliative medicine consultant with more than 10 years of experience in the field, practicing in both oncology and non-oncology settings. He is a frequent presenter on multiple topics in supportive oncology and symptom management. Nikki Castle has practiced in palliative and hospice nursing since 2003 and as an advanced practice palliative care nurse since 2005. She is board certified in advanced practice hospice and palliative nursing and is the director of palliative care for Carolinas Healthcare System and has the responsibility for 9 inpatient consulting teams and 4 outpatient clinics. She is currently pursuing her doctorate of nursing practice at Duke University. In 2010, she was awarded the Advanced Practice Hospice and Palliative Nurse of the Year and continues to work closely with her local and national hospice and palliative nurses association. Shelly Aimbach is a music teacher who lives in Minnesota with her husband and 2 children. In 2013, after a periocardiosynthesis, Shelly was diagnosed with stage 4 adenocarcinoma. She was 40 years old. Shelly's treatments have included chemotherapy, a targeted therapy, and 2 clinical trials. Her first clinical trial kept her cancer stable for 26 months. The clinical trial she's currently on is working well, and her recent scans showed no evidence of disease. In addition to working, raising her family, and her active community involvement, Shelly is a fierce lung cancer advocate. Shelly's efforts on Capitol Hill led to the creation of the Lung Cancer Caucus. She holds awareness-raising events like LCA Shine a Light on Lung Cancer, is a mentor to others diagnosed with the disease, and has represented the lung cancer community at meetings and on national and international advisory boards. So here's our agenda for today. We're going to have Shelly start us out by telling us more about her lung cancer journey. We'll hear from Nikki, who will give us a thorough overview of fatigue, and then Dr. Kravitsky will provide guidance on how to manage it. To wrap us up, Shelly will share tips she used when her fatigue was most problematic. So as we go through the presentations, please enter your questions to the right of the screen. You can do that as they go so that you don't forget them. We'll have some time at the end of the presentations for our experts to answer your questions. So now we're going to start with Shelly, and she's going to share more of her story and her experiences.
Hello, everyone. I'm from Osakis, which is a rural town in central Minnesota. I'm married to a wonderful man named Scott, and we have two amazing children, Caden, who is 14, and Chase, who is now 11. When I was diagnosed with stage 4 lung cancer, I was teaching K-12 music full-time. Since diagnosis, I have taught part-time music, directed a area children's choir, and the varsity boys and girls golf coach, and found a new passion in lung cancer advocacy. For me, there have been two different types of fatigue that I've experienced with my cancer journey. The first was the fatigue I experienced while taking chemotherapy. I took chemotherapy treatments for 11 months. This type of fatigue came in a distinct 3-week pattern for me. I received my infusion chemotherapy treatment once every 3 weeks, so that's why the 3-week pattern. The day of and after chemo were not too bad, as I would still have the comfort drugs still in my system. But the week after, that was the week where I felt the worst and had the most fatigue. The majority of those days were couch days. I did not do much other than shower, eat, sleep, and maybe watch some TV. I didn't feel like eating, but I remember forcing myself to eat so that I would not get weak. I think keeping nourished during chemo really helped me avoid more fatigue. Staying hydrated is also so important with any kind of cancer treatment. The second week after chemo, my white blood count was at its lowest of the 3-week cycle. I usually laid pretty low during this time. Fatigue-wise, it was a little better than the first week, but not as good as the 3rd week coming up. Boy, by that 3rd week, I felt as normal as I did while on chemo. I had the most energy and the least amount of fatigue. That's when I would plan family vacations, lunch dates, etc. during that 3rd week. I always look forward to that 3rd week. Now, fatigue on targeted therapies is different than the fatigue on chemotherapy. I've been on targeted therapy treatment for the past 2.5 years. When I think about fatigue and targeted therapies, I kind of compare my fatigue level to before I was diagnosed. I estimate while on a target therapy, I'm about 75% of what I used to be able to do before diagnosis. I've been able to teach part-time and coach at the varsity level, and I can do this by planning out my days and making sure I don't overdo it. After diagnosis, I had to put my priorities in perspective. My family became even more important, and I resigned my full-time teaching position. I have 2 children. Caden, my daughter, was 10, and Chase, my son, was 7 when I was diagnosed. They learned the 3-week cycle quick, knowing their mom struggled initially after chemo, but that it got better the 3rd week. Now, while on target therapies, my energy level is much more consistent, and so we're able to golf 18 holes most days instead of the 36 maybe we were accustomed to before. I think it's important for cancer patients to be really aware of their fatigue level and plan accordingly for the best use of their energy. Hopefully, with the information presented today, you'll be able to find ways to cope with fatigue.
Thank you so much, Shelly. That was really great. And now we're going to hear from Nikki, who will help us understand more about fatigue.
Thank you, Maureen, and thank you, Shelly, for sharing your story and a little bit of insight into your journey. So I welcome you all to talk about this very common issue that you may be experiencing and that many people do when going through lung cancer. So as Maureen alluded to earlier, fatigue is an extremely common symptom that folks deal with. It's been reported that over 90% of people experience fatigue during their cancer treatment, and over a third of patients actually experience fatigue 5 years post-treatment. So this is truly a symptom that can impact someone's quality of life for a long time. Tends to be very underreported, and which leads to being underdiagnosed and undertreated. And I really think the reason for all of this is fatigue is very normalized. There is this common perception that fatigue is just a normal part of having cancer and having treatment. And so many patients feel that because of that normality of the fatigue or the expectation, that they don't need to talk about it when they're meeting with their medical teams, that it may just be a given and that there's no reason to look into it further or to look into why it's happening or if there's anything that can be done about the symptom. So just a few pictures there for you to kind of set the mood. I'm not sure if this looks familiar to any of you who are watching, but when I talk with patients, this is how they describe their feelings through the day or themselves, is that at any moment, even when they're trying to get through their normal activities, that they need to stop, they need to rest, and that they sometimes, patients tell me that they're not able to put one foot in front of another. So it can be an extremely debilitating symptom and one that we need to talk more about because of its frequency. So let's talk about more of an overview of the symptom, and we'll talk more details after that. So fatigue overall has many causes, which we'll go into. Treatment, which Dr. Kravitsky will speak more about, will include more both behavioral or lifestyle options or modifications in addition to a few medication options. And then what's very important for your medical team is that a thorough history throughout your medical history as well as a recent medical history, that is very critical to diagnosing the cause of fatigue and any options for treatment. So I want to start with differentiating general fatigue from cancer-related fatigue. There is a difference. General fatigue, when that is defined, that's really defined by a lack of energy and motivation. That can be both physical and mental, or one or the other. Not the same as just feeling that normal kind of drowsiness and, oh, maybe I didn't get enough sleep last night, so I'm a little tired. Much more significant than that. It can be characterized by less ability to get your work done through the day or to participate in the same amount of activities. And typically people feel that they're not able to accomplish as much. And then in addition to just a general sense of being tired and fatigued, some people do feel very weary. They feel, I have people tell me sometimes when it's not related to cancer fatigue that they almost feel that they're sad. It really affects their mood because of being so tired. What is the distinguishing factor with general fatigue versus cancer-related fatigue is that general fatigue is known to improve with rest and recovery. So it may take a lot of rest or a lot of recovery if someone has become kind of chronically fatigued, but typically there is a difference once the person is able to kind of sit and reset. When we talk about cancer-related fatigue, which is what we're going to be focused on today, there is a difference. And the primary difference, as I mentioned, is that it typically does not improve with rest or sleep. Sometimes, and that's what I hear from patients, is I take naps during the day, I sleep well during the night, and it never gets better. I just constantly feel tired. It lasts longer than someone who's maybe just dealing with a situational fatigue. And there's this overall just feeling of being weak and listless and sometimes feeling washed out. It can be very impactful in someone's cognitive ability, so their ability to think and go through their normal day and activities. Excuse me. And for many, people say that this inability to function on a normal level actually is more distressing for many people than symptoms of pain, nausea, or depression. And many people have told me, as well as what's quoted in the literature, is sometimes patients feel that this is the worst part of their treatment, that they just feel so washed out that it's almost a constant reminder of what they're going through. So why does this happen? What are the causes? And we're going to spend a few minutes kind of going through this. Cancer and cancer treatment, whether it's chemotherapy, radiation, surgery, they all can lead to fatigue. There are many protein and hormone levels that are typically regulated in one's body that can be altered from the cancer process. And then those hormone levels, when they're altered, leads to more increased inflammatory processes throughout the body. So anytime there's increased inflammation in the body, that can increase the feelings of fatigue. It's also been found that there's this increased use of energy of the body's normal kind of cleanup and functioning processes to clean up the cell waste after the treatment has gone into the body, has started to kill the cancer cells, and of course other cells as well. So the body is almost working on overtime. I tell my patients that essentially with cancer and really with a lot of the chronic illnesses, that your body feels like it's running a marathon all the time because it's working so hard, even when you're lying down, even when you're sitting. The body is working very hard to do its job and to keep you as healthy as possible. Also, both cancer and cancer-related treatments can create toxic substances within the body that will change your normal processes, which we'll talk a little bit more about. Low blood cell counts, whether that's your white blood cell, your red blood cells, any type of dip in that from your treatments can lead to increased fatigue. Sleep disturbances are huge. This can be something that's related to general or cancer-related fatigue, and you'll hear more about later. And then it's also noted that it accompanies other distressing symptoms. So if any of you have had pain, anxiety, depression, any other type of distressing symptom, think about, did it also lead to you feeling more tired? And it could be that the body is under stress because of the symptom. It could be because of the medication that maybe you're using to treat the symptom, but they can be related. And then lack of exercise. Lack of exercise is one of those double-edged swords. To where you maybe feel that you're too tired to exercise and to get more activity, but actually decreased activity and exercise lead to more fatigue. So that can be kind of a vicious cycle for someone going through cancer and cancer treatment. Other considerations, just to talk more about those blood cell counts that I mentioned, with anemia. Anemia can occur throughout the course of cancer, and cancer cancer itself, the actual process, can cause fatigue by spreading throughout the bone marrow and leading to a low red blood cell count. You've probably heard this, but just as a reminder, red blood cells are the part of our blood that carry oxygen, which fuels the rest of the cells in the body. And so when there is a low level or too few of the red blood cells, this means that there's not enough oxygen or energy to meet the body's needs. And so your body has to decide, if I've only got a low level of this oxygen and energy in my body, where will I put that? Does it go more toward my heart function? Does it go more toward my gut function? Or does it go more to my functional abilities? So it has to make that decision, and some part of your body will lose out. Chemo and radiation can also, as you know, affect the bone marrow and the blood cell counts, which can lead to this deprivation and also to increased blood cell count. Symptoms of anemia, they may get worse as those levels go down, and they may include a fast heartbeat. Sometimes people feel short of breath, especially with activity. Some people feel dizzy, and you may notice that your skin is more pale. It may be pale on your nail beds and around your mouth, and then the overall increased fatigue. So that's a very significant symptom that if you're feeling any of those that I mentioned, your medical providers need to know about it. Another consideration is depression or any other emotional issues such as anxiety. Fatigue and depression are very highly linked, whether that's more of a situational depression because of a new diagnosis, or perhaps you are going through some grief related to your change in your lifestyle or ability to do other things that are normal for you. That can lead to fatigue. Sleep disorders, whether or not that's those occurred before or after a cancer diagnosis. Medications are a large culprit for fatigue. Medications that are used for pain, such as opiates or narcotics, they can be sedating and make you tired. Sleep medications, many patients don't tolerate sleep medications, and they describe it as feeling almost hungover the next morning, and so it creates a cycle of an inability to get their rest and energy. Antidepressants can lead to fatigue, and so again, another one of those vicious cycles. If we don't treat the depression, fatigue tends to increase, and then there are some medications for depression that lead to fatigue. So we really have to be careful with our medications and how they're used. Some anti-nausea medications, anti-seizures, and then also some heart medicines that are used for your heart rate control or your rhythm control, those can also make you tired. As Shelly mentioned earlier, nutrition and hydration are huge. This is one of those considerations that always needs to be discussed. I find in my patients that this also is a little too underreported. People have told me that they feel like not feeling like eating or not feeling like drinking is just part of what they should expect, so they don't report it as often. So it's important that you share these issues with your providers and your medical team so they can help you get the intervention that you need, and it can also lead to an energy increase. Other medical problems may have not caused that much fatigue before cancer, but combined, it could lead to increased fatigue. So any major organ disease, such as lung disease, anyone with COPD, any other kind of lung diseases prior to a lung cancer diagnosis can lead to increased fatigue. Infections related to those inflammatory processes I spoke about earlier, hormonal changes, and thyroid disorders are all very well known for increasing fatigue. So more specific to you all today, to those with lung cancer, we have found in treating patients with lung cancer that associated symptoms tend to be high with pain, depression, and sleep disorders. And so, as I mentioned earlier, fatigue is highly associated with these symptoms. So in this patient population, this is something we need to screen for often. It's been often reported as the most significant unmet need. So again, I'll go back to that underreported leads to underdiagnosed and undertreatment. So we need to work together as patients and clinicians in talking more about this. It can be due to other health problems, such as that previously diagnosed lung disease, such as COPD, emphysema, asthma, etc. And it also can be related to any changes in oxygen levels and that shortness of breath. When people have been living with low oxygen levels or shortness of breath for a while, it's almost like becoming tired has become a normal part of their life. And so, again, it's normalized and not talked about enough, and this can be a cycle that leads, is created for people with lung cancer and their abilities to regain their energy. So as the patient and I work together, it's important that we collaborate to determine the cause. The way I approach this as a clinician is to really do a thorough history of any medications and the medical history. So to make sure that the medications that the patients are taking are necessary, that they're being taken at the correct time of day. I find many times people are on antidepressants that are known to be sedating, and they take them in the morning. And if we switch them to the nighttime, they actually do much better. So that history is very important. Often we will ask patients to do a daily activity report or log so we understand better what their day looks like and if there are any triggering factors. We talk a lot about sleep patterns, so I will leave that to Dr. Kravitsky for a few minutes later. Lab studies can be important for the clinicians to truly look for those low blood cell counts, looking for thyroid disorders, other major organ issues, to help us understand if there's anything reversible that we can treat to help the fatigue improve. It may be, directly related to the lung cancer, or it may be something that's caused because of the lung cancer or because of the cancer treatment. So we need to be able to dig into that a little bit more. The physical exam is also very important. This will help me understand if there's anything else going on, if there's any signs of infection, such as pneumonias, or change in breath sounds or heart sounds that may help me understand if there's something contributing to the fatigue. And then again, a good family and social history, because that helps me understand the situation that the patient is in, so that if there's any modifying factors that we can suggest to help the fatigue improve, we can do that. So I am going to turn it over to Dr. Kravitsky to take all of this information and tell you what we do next, how we treat this.
Well, good afternoon, everyone, and I appreciate in-depth analysis from Nikki, and as well as Shelly's story on what she's been through in her illness and how she's been able to cope with it. So both Nikki and I see patients in our Cancer Institute as part of the team who cares for patients that have cancer, lung cancer, and other types of cancer, including other hematologic problems. So unfortunately, I think what we see throughout the landscape of medical practice is that fatigue is something that unites pretty much everyone who suffers from a chronic medical illness, including cancer. And this is why there's so much focus, and unfortunately, that's why we have so much experience in dealing with this, because practically speaking, every patient that we see has some form of fatigue. And as Nikki said, it's very important to decipher why they're suffering from fatigue. Is it something that we can change, something we can improve? And there's typically things that we can do to make it better regardless of the reason. So frequently where we start is really advise patients to monitor their fatigue levels. Because of what we see as this normalization of certain symptoms when patients develop either treatable or and curable cancer, or treatable and incurable cancer, there's this feeling that this is how I'm supposed to feel. This is what I see on TV. There's other patients that I see at the oncologist's office, in the waiting room, at the infusion center. We all going through this, and so this is sort of normalized as not feeling well. And the first step is truly to figure out when do you experience your fatigue? Is it the timing of it is important? And when you're thinking about it, you become more intentional about your day-to-day activities. As Shelly mentioned, so much of it depends on the cycle of treatment, other medications, how much fatigue somebody may have had prior to diagnosis. Because remember, many cancers get diagnosed after the cancer's been in your body for many months or years even. And so this feeling of feeling washed out, feeling fatigued, has been present for a while, even before the diagnosis. So upon the diagnosis of cancer, if it doesn't change, it doesn't seem as bad. So establishing a routine is a very important part of figuring out and being intentional about your day-to-day activities. Frequently, our routines are forced upon us, right? We get up in the morning, we have children in the house, we got to get them to school, we have jobs, we got to get ready and go. When you get diagnosed with cancer, frequently some patients continue to work, but as Shelly reported in her part, she had to really pull back from her daily activities, and so some of that routine goes away. And so we easily fall into this the abyss of feeling tired, laying around a lot, not really doing anything, not having to go anywhere but doctor's appointments, scan appointments, maybe some family functions, but really loss of routine frequently potentiates the fatigue level. And so reestablishing a routine for the sake of routine and improvement of your fatigue level is one of the ways that we use as a jumping off point. Practice energy conservation techniques is something we talk with patients about. You know, writing down or prioritizing activities in a way that makes sense to you. There's certain things that have to be done, and there's certain things that are a bonus. And I think Shelly alluded to that in her story, is that, you know, some of the things that you typically have done, you have to decide, do you need to continue doing it, or is it something that you potentially may skip and focus on the things that are absolutely important or necessary. Nutrition, and I think Nikki touched upon that, and hydration is a very important part. And, you know, a lot of patients asked us, what about vitamins? What about what type of food? And, you know, there's the different books and websites and advocate for certain diets, and I think, you know, the place to start is really, you know, asking your medical team, which frequently includes a dietitian, to really help you prioritize nutritional support, even in the time when eating is not a huge part of your life. But also, unfortunately, because meals are so important socially, it has that interaction with our daily lives that sometimes we miss out on. So caloric intake is absolutely critical to maintain your level of function. You know, this is not a discussion about pain, but a lot of what we see is pain, and pain can affect patients in so many different ways, including inducing depression and fatigue and worsening every possible aspect of your life. So addressing, managing your pain, making sure that the medical team who is caring for you is aware of your pain, aware of your pain patterns, and that you seek out the best possible answers in pain management, because that frequently becomes the cornerstone of treatment. As important as managing pain, sleep has always been, to me, sort of this golden child of what we do to help patients managing their day-to-day activities. And when we lose our routine, it frequently affects our sleep routine, because when we have reason to get up, we usually have a set time to go to bed. When you start to lose that, you start to lose the normalcy, and your body gets, unfortunately, our bodies thrive on routine, right? We all know that. We see it in our children, pets, and we see it in our patients. So routine is something that your body craves. So when we have a variable sleep schedule or frequent naps, that interferes with our good nighttime sleep. Nighttime sleep is always better than daytime sleep, because frequently daytime sleep is not long enough to achieve that, what we call REM sleep, or rapid eye movement sleep, which takes at least an hour and a half to 3 hours in some patients to achieve, where total relaxation occurs. So when we talk to patients about good sleep hygiene, what we mean by that is having a routine. So establishing a nighttime routine, meaning setting the clock to both go to bed and wake up, so that your time asleep is assigned. Reducing stress before you're going to bed. Using the time before bed, we recommend 2 hours. I know it's hard for a lot of people because our lives now revolve around electronic devices, and I have 3 of them sitting in front of me right now. So I know how difficult it is for us to cut ourselves off, but new screens definitely are known to interfere with sleep patterns. And using that no screen time to really reflect upon your day, positives, negatives, journaling, any other activity that does not include electronics, and really using that time for yourself or for set activities that are not exercise, because you don't want to rev your body up right before sleep. Obviously, avoiding caffeine, tobacco products, or alcohol before bed, and recommend not having any caffeine-containing products after 12 p.m. And use of alcohol and tobacco in the evening also interferes with sleep patterns. Limiting nap time during the day will obviously increase your desire to go to bed on time at night. And not having your bedroom be used for anything other than sleep. So if you're just resting, plan a nap. If you know you're going to need a nap, just plan it, go to your bedroom, go to sleep for 30 minutes, 45 minutes, set an alarm, get up, leave the bedroom, be active. Other things that we recommend at the time, before going to bed, is the time for self-reflection and meditation. Frequently benefits patients. And if all of that is done and you're doing your best and you're still having a hard time getting to sleep, asking your medical team to address your insomnia. Maybe you have suffered from insomnia periodically throughout your life, and now it is worse. That is definitely an appropriate time to discuss it with your medical team to make sure that it is addressed appropriately. And Nikki has already spoken somewhat about this, but the number one, and this is a really well-studied subject, and studies continue to show that activity throughout the day is still better for managing fatigue in cancer patients and non-cancer patients than really any medication or anything else. So being physically active, whether you're doing yoga, participating in some sort of structured exercise program, if you have are struggling with some of your physical mobility, as we see some patients, starting as a physical therapy referral, maybe is something where the first step for some patients that have more mobility issues. Massage has been found to sort of help with managing some of the musculoskeletal symptoms that can potentially improve your ability to function, because whether you're undergoing chemotherapy or radiation therapy, this has a lot of musculoskeletal side effects that can be helped by therapeutic massage. Also, acupuncture has been found to be beneficial, and that goes for wellness acupuncture, meaning not a specific acupuncture point, and also specific targeted acupuncture therapies for specific indications. And that's something that we feel very strongly about, to have patients be able to access these type of therapies. I know a lot of cancer centers have relationships with local YMCAs or other gyms that really focus on maintenance and potential improvement of patients' stamina through exercise. I think this has been discussed already by both Shelly and Nikki, but a lot of times we can't go to sleep because we're stressed out. We're having a hard time coping with a diagnosis, whether it's new or ongoing, expectations for scans, going to see a physician. It's always a stressful and sometimes emotional situation. So making sure that you self-reflect and ask, make sure that your medical team is addressing your depression and anxiety as part of this holistic approach to treatment is an important part of all this. We use medications for treatment of depression and anxiety, and specifically select medications that actually increase what we call stamina, or that are what we call activating medications, instead of using antidepressants that are more sedating. And sometimes we do use sedating antidepressants at night to induce sleep. So it's your medical professional will have to make the proper judgment of what your particular situation will benefit from most. After doing all the things that you can be doing on your own, in all the slides that we went through, sometimes it takes medications to help insomnia. We just talked about treating depression, whether using antidepressants to induce sleep or using antidepressants to be activating during the day. Majority of medications for anxiety, unfortunately, are sedating, but not all of them. And primary medication for anxiety is actually antidepressants. So a lot of patients are being prescribed sedatives such as benzodiazepines, whether it's Xanax, Ativan, Klonopin, Valium, and they're depressants. They're not going to help you activate better. And unfortunately, some of the sleep patterns that are induced with anti-anxiety medicines are not the most healthy sleep patterns. So using the antidepressants as the first line for management of anxiety is actually something that we would like to see more of. And working closely with our Levine Cancer Institute psychiatrist, helping patients with the appropriate medication management is part of what we do on a daily basis. And I think this talk would not be complete without saying that even if we do everything correctly, and you have gone and you have listened and you have implemented every possible intervention that has been suggested through exercise or management of your schedule and daily routine and sleep hygiene and everything else you have done, and everything continues to help you slightly, but still not quite there. In some instances, we have prescribed stimulants. Now, Ritalin is probably the most common stimulant used, but there are others on the market that are prescribed for this very reason. And stimulants are really used as a jumping-off point to a pharmacological treatment of fatigue that hopefully gets you started down a path of more of an ability to exercise, better stamina during the day, so that you nap better, you nap less, and sleep better at night. And it doesn't have to be used continually. It can be used in a very targeted approach with selecting certain days when you have things that you want to attend, whether it's kids' sport event or a church function or a birthday or a lunch with friends that you have not seen in some time. These are the medications that we use in a very targeted way that people can continue to function, that they can feel like they are part of the community and their lives continue to go on, so they're not consumed by their illness and its side effects. I think I'm going to stop here, and hopefully we can have some questions from the audience.
Okay, thank you so much for that great information. Before we go to questions, we are going to have Shelly share a little bit more about her experience. There we go. She's going to share some of the tips that she found were helpful during her times of the greatest fatigue. So, Shelly, take it away.
All right. Well, as the good doctor also reiterated, you need to stay hydrated. And that's, like I said, any type of cancer treatment, whether it was my chemotherapy, my targeted therapies, I still now try to push myself to drink a gallon of water a day, and it seems like it's insurmountable, but if you just take it all throughout the day, it works out well. And staying nourished too. Just forcing yourself to eat when you don't feel like eating just because you know you need to keep up your strength. That was one of my biggest things that I did when I was going through chemotherapy. A patient shared that with me, and so now I pay it forward and share it with you as well. Also, I rested when I was tired. I know that sounds simple, but it can be challenging when you want to do other things that you were used to be able to do before diagnosis. So again, rest when you're tired, and then schedule events when you and your family, what are good for you and your family. For me, it was that third week, but I mean, plan and have things to look forward to, because it's important and hopeful for us too to always look forward to events, even if it's a simple lunch date. Maybe it's an engagement with a friend you haven't seen for a while, or you and your kids are going to the park, something like that. Look forward, plan it, and look forward to it. Thank you.
Okay, great, Shelly. Thanks so much. We do have about 10 minutes now for some questions. And again, please continue to enter your questions to the right of your screen. And please know that any that we don't have time for, we will answer individually by email. And while you're here, if you just want to jot down my email address as well, just in case you think of questions after the webinar, you can email me directly. So for Nikki or Dr. Kravitsky, if you could, or maybe both, so I think it's understandable why people have fatigue during their treatment. Can one of you explain why it might last for so many years after someone is out of treatment?
This is Nikki. I can start and hand off. You know, I think there's a couple of reasons. If you go back to what causes fatigue to begin with, a lot of those factors don't go away after the cancer is gone or after treatment has been completed. I think also, as Dr. Kravitsky alluded to, when routines and life changes, everything tends to change. So whether that's medications, whether that's sleep patterns, activity tolerance may be very different after treatment is over than it was a few years ago. There's also a lot of hormonal, protein, chemical changes in the body following cancer experience and cancer treatment as well. So, you know, even though maybe the triggering culprit is gone, whether that be the chemotherapy or the agent that you're receiving, a lot changes in the body function in addition to the normal routine and kind of lifestyle of the person.
I think what we frequently, that was well said, Nikki. I think what we frequently tell patients, this is your new normal, so, and this new normal is going to be different than your old normal, before the diagnosis, before the treatment. So I think just recognizing that there's going to be a shift in baselines and expectations should be appropriately adjusted to that.
Okay, great. And for Shelly, we know that Dr. Kravitsky, wisely recommended that folks talk with their treatment teams about any, dietary changes and that type of thing. But did you find any particular food way of eating that impacted your fatigue beyond, obviously the hydration that you found so important?
No, but my nutritionist did tell me, and it was a very happy moment when she said, this is one time in your life where you don't have to worry about diet. You don't have to worry about your weight. We want you to keep your weight on. You can eat what you want to eat. This was during chemotherapy when your food sensors are all out of whack. Of course, they don't tell me that now on targeted therapies, but when I was on the chemotherapy, that's the information they shared with me, but of course they wanted you to eat the nutritious things versus the non-nutritious things, but they said just plain eat.
Okay, that's great advice. So I'm just going to summarize this. And you all touched on it a bit. I'd be interested to hear if you have tips. So you talked about the difficulty of being active when someone feels so tired. Can you talk more about or give any tips for small ways that someone can increase their activity level as they build up? I think sometimes we all think, you have to be, be at a gym and lifting weights and that kind of thing. But if you could just talk about small ways that people can increase their activity levels a little at a time, I think that would be helpful.
For me, what I did when I was on chemotherapy, and this was a suggestion from one of my sister-in-law, who was actually a physical trainer, and she said, just do little things. Just get up and go to the bathroom, even if you don't have to go, and then maybe do 2 stairs. At the time I was living in a split-level house, and so then she said, and then the next time you get up, maybe try to do 3 stairs. And then maybe the next day, maybe you're going to do that whole flight of 5 or 6 stairs. So it was just doing things in little increments, but adding them a little bit more each day or a little bit more each time you tried seemed to work well for me.
That is precisely what I tell patients. I think it's I always say start with 30 seconds and add 30 seconds every day, or start with 1 minute, add a minute every day, and before you know it, you're doing a lot more than you ever thought possible.
And I think, too, when you approach it that way, what I tell patients is that you get small wins, because it's kind of like if you go out and you say, okay, day 1, I'm going to go walk a mile, and you're exhausted and you can't do it, there is this sense of failure or, oh, my goodness, I'm never going to get there. But if you start with those small increments, as Shelly was pointing out, you can celebrate your improvement, and it's a much more secure celebration. And as we all know, you want every celebration you can have. And so if you have kind of the baby step goals, you can celebrate each time you move up.
Thanks. That's all really helpful. And just to Patricia, I'll go into it a little bit later, but yes, you can definitely watch this presentation again on our YouTube channel, and I'll explain how to do that. And one final question from one of our health care professionals who is listening in, and he or she asked if you used the brief fatigue inventory questionnaire or another questioning to measure fatigue.
So in our Cancer Institute, where Dr. Kravitsky and I are, we rely on our ESAS. We do an ESAS score, which is the Edmonton Symptom Assessment Scale, for all of the 10 items. And so really how I use that in practice is to guide my discussion and determine what I need to dig into a little bit further. Not sure about you that was asking. I mean, we have a little bit of tool fatigue, sometimes in our outpatient setting. And so sometimes we will use one tool that triggers another tool. So that's a great one, and it's got great, literature behind it. So I think that's very important. But we tend to do the overall ESOS to help guide us.
Okay, terrific. So I think that's all the time we have for questions today. I'd like to thank all of you for joining us, and we really hope this webinar has provided you valuable information on fatigue and helped you to understand the importance of addressing it, and has given you some ideas on how you can start to manage it. To watch this presentation again, or to see others in the coping series that we did earlier this year, you can visit the Lung Cancer Alliance YouTube page and just check under the videos tab on that page. And again, Lung Cancer Alliance is here to answer any questions about fatigue or anything else related to lung cancer. You can just call our helpline or email us. We will be sending the Coping with Fatigue fact sheet out to everyone who joined us today. And if you're watching a recording of this webinar and would like a copy, just email support@Lung Cancer Alliance, and we'll send one along to you. So we wanted to give a special thanks to survivor Shelly Aimbach for sharing her experiences, and to Nikki Castle and Dr. Kravitsky for helping us understand more about fatigue and how to manage it. We really appreciate the dedication that you all show to improving the lives of people diagnosed with lung cancer. And so this is the last webinar of our series for the year, but do stay tuned for more of the Coping With series coming in 2018. So we wish you all a great day, and thank you all for participating.